We're here with Eyerising International, and they've brought their myopia management device featuring repeated low-level red light therapy and a host of insights about the device in the midst of the myopia epidemic. To go deeper into this tool and its potential, we're joined by Dr. Neema Ghorbani Mojarrad of the University of Bradford, who's auditing Eyerising's myopia management device as a service evaluation for its potential introduction into the UK.
Hi, my name is Neema Ghorbani Mojarrad. I'm an lecturer and assistant professor at the University of Bradford with an interest in myopia management. I first came across the Eyerising myopia management device back in early 2023 when they first published their results of their clinical trial. I contacted the company to see if I can get some of the machines to test, and they kindly provided some so that we could see how it works and try it out ourselves. I also decided to have a look and talk to some other practitioners and researchers as to whether they wanted to get involved and have a look at it too and what their thoughts were. One of the benefits for the use of this machine potentially for myopia management is that it's done at home, which means it can be done under parental supervision. Sometimes children may not be compliant with wearing their spectacles when they're not under parental supervision. Here, all of the treatment's done at home and can be done with their parents or guardians with them. So with the mechanism of action, we are not entirely sure exactly how it works, but it's suggested to be an improvement of blood flow to the back of the eye. So the changes at the back of the eye that have shown in some initial studies to potentially reduce the kind of length of the eye, but most of the time the data is showing that it slows the progression of the eye growth in general. So far in the UK pilot, we've recruited over 13 children. Over 8 different practices have taken part in the UK pilot, and they range across from all around the UK. The main objective of the UK audit has been essentially to determine how the introduction of red light therapy and the Eyerising device has gone in the UK. It's important because most of the data from the machine has come from other countries and hasn't been launched in the UK yet. So here we were trying to see how UK practices and UK patients get on with red light therapy. Generally, the results are still preliminary and haven't finished, but they look to be trending positive. So far in the UK pilot, there have been no adverse events for red light therapy. What we found about compliance is when patients may not be remembering to use their device, the software that tracks how often they use it has been picking up that and sending reminders to patients to make sure they use it. So what we found with the perception of colour short term with red light therapy is that, as expected, once you've used the device, you find that you have some after image that does affect colour vision, but that generally speaking does go back to normal within 5 minutes for everyone that we've trialled. The Eyerising myopia management device offers a new, novel opportunity to use a non-optical approach for myopia management. It's a great additional aspect into the toolbox that practitioners can have to use combat myopia management and find the best treatment for their patient. It's nice to have a non-optical intervention that is done at home.
The myopia epidemic is ongoing, and research into repeated low-level red light therapy and the answers it may hold is still ongoing. Dr. Neema is one among many looking to evaluate the body of evidence on the efficacy and safety of this promising technology. For more on what's out there, check out Eyerising's website today.